Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now, for what you're actually here for, let's talk about bitemporal hemianopsia. To learn about this topic, you have to know about the visual pathway. So let's talk about it. This image shows a top-down view of the visual pathway. So let's start off with our eyeballs. We're going to make our way back toward the back of the brain, starting off with the optic nerves. As we go down, we're going to reach the optic chiasm, which looks like an X. Then it's going to turn into what is called the optic tract, which sends information to the LGN, aka the lateral geniculate nucleus. This is in the thalamus. After that, we have optic radiations that send information from the LGN to the primary visual cortex, which is where all of the afferent information is then processed. This is a purely afferent pathway. Nothing motor is happening at all. What I want you to notice is that each eyeball has two tracks. So if we look at the left eyeball, you're going to see that there is a blue line and a red line. You look at the right eyeball, same thing. There's a blue line and a red line. You're going to see that for both of the eyeballs, the blue line is on the left side, while the red line is on the right side of each respective eyeball. Now look at the left side of each eyeball, the blue side. Look at what information is received. What's received is visual information from the contralateral side. So left side of each eyeball is going to receive right-sided visual field information, while the right side of each eyeball is going to receive information about the left visual field, still contralateral. Now we're going to follow the blue and red lines of both eyes to where it then becomes the optic nerve. We're going to continue making our way back towards the back of the brain, and we're going to eventually reach the optic chiasm. And this is the junction that looks like an X, and it looks a little confusing because there's a lot of crossing over that happens. However, it really isn't that confusing, so let's just break it down. So look at the two blue lines starting from both of the eyes. You're going to see that the two blue lines, even though they were on different eyes, they're both going to go to the left side of the brain. They are both going to get to the LGN that's on the left side of the brain. Same thing goes with the red lines, or the right side of each eye. Both of these lines, the red lines, are going to make their way to the right side of the brain, the right LGN, the right primary visual cortex. So when you break this down, you're going to see that there are a total of 4 lines. And of these 4, only 2 of them actually cross over at the optic chiasm. And the 2 that cross over are the ones that are in the middle. So the right side of the left eye and the left side of the right eye. I'm going to go over this concept one more time, but in a different way. If you look at the left eye and follow the blue line, so the left side of the left eye, you'll see that this line stays on the left side until it reaches the back of the brain, the primary visual cortex. Then if you look at the right eye and look at the blue line, so the left side of the right eye, this line has to cross over through the optic chiasm to then reach the left side of the brain. Same thing with the right side of the left eye, the right side of the right eye. So you look at the right side of the left eye, that's a red line. This does cross over to the right side through the optic chiasm to reach the right side of the brain. While the right side of the right eye, the other red line, this does not have to cross over the optic chiasm because it's already on the right side. So essentially, blue, aka the left side of both of the eyes, they're going to stay on the left. The right side of each eye, the red, they're going to stay on the right side of the brain. Once it reaches the LGN, right, this is where the information is sent to then the primary visual cortex through what is known as the optic radiations. As you can see, there is more to the visual pathway. However, since we're just specifically going into bitemporal hemianopsia, this is where we can stop. So when you look at this image, you will see that bitemporal hemianopsia is a defect that presents when there is some sort of damage to the optic chiasm in particular. On this image, it's labeled as number 2. So you're going to see that there's a yellow line that goes vertically through the optic chiasm. What actually goes through the optic chiasm, you will see, again, it's only the middle 2 tracks or the medial aspects of both of the eyes. That's what's affected. So the left side of the right eye and the right side of the left eye are affected. The outer tracks, left side of left eye, right side of right eye, these are not affected at all because they don't go through the optic chiasm. So essentially, the information coming from the outer aspects or the lateral aspects of each eye should still work. It's going to be sent to the brain, no problem. But the information that is sent from the two medial tracts, this is not going to be sent to the brain. So our patients will not see anything with respect to the information that is seen from the medial aspects of each eye. Take a look at this schematic of how a patient would essentially view the world if they do have bitemporal hemianopsia. The red suggests that it's a blind spot, so your patient cannot see anything that the red covers. The white suggests that you actually can see something, it's not blind. This is exactly how this person would present. A person would not be able to see anything at the lateral aspect of their field of view. And that's because the medial aspects of our eyes, which receives the contralateral information, aka the lateral field of vision, these are damaged. So when you are having your patient do a visual field test and you're wiggling your finger to see what they can see, you're going to expect that they cannot see anything on the lateral part of their vision, but they can see things in the middle of their view, the medial aspect. They're just not going to have any reaction to the lateral aspect since they can't see anything. If you enjoy material being taught this way, check out our courses at sptwithme.com when you're studying for the NPTE. For more information, check out these references.